So, good morning. I am Geraldine D. Alcantara from BSN2 Block 9, and today I will be presenting a comprehensive overview of furosemide, a loop diuretic widely used in clinical practice. So, without further ado, let's get into the introduction. So for the topic outline, it is comprehensive review of furosemide, pharmacological properties, indications, contraindications, side effects, interactions, dosage, administration, nursing considerations, and interventions. So let's start with a brief introduction. So furosemide is a medication belonging to the class of loop diuretics, and it plays a crucial role in managing conditions such as edema and hypertension. So it says here that furosemide is a medication belonging to the class of loop diuretics, or also known as water pills. So furosemide is given to help or to treat fluid retentions or edema and swelling that is caused by congestive heart failure, liver disease, kidney disease, or other medical conditions. So it says here that furosemide are organic compounds containing a benzene sulfonamide with an amine group attached to a benzene ring. So in simple terms, furosemide is a composed of carbon, hydrogen, chlorine, nitrogen, oxygen, and sulfur atoms arranged in a specific configuration. So the structures consists of a foreign ring, a sulfamoyl group, and antranilic acid derivative. This combination imparts its diuretic properties by inhibiting the reabsorption of sodium and chloride in the loop of Henle in the kidneys. So moving on to its pharmacological properties, furosemide works by inhibiting the reabsorption of sodium and chloride in the ascending loop of Henle, leading to increased excretion of water and electrolytes. Its onset of action is rapid, usually 30 minutes, and it has a duration of approximately 6 hours. So basically, there are common and serious side effects of these drugs. So for the common, it can increase uric acid, resulting having a gout, headache, high blood pressure, high sugar, low calcium, low potassium, low magnesium, muscle spasm, and etc. And for the rare and serious, it can cause hearing impairment, kidney toxicity, blood disorders, ringing in the ears, anaphylaxis, rashes, and others. So now let's discuss the primary indications for furosemide. So it's commonly prescribed for the treatment of edema associated with conditions like heart failure, cirrhosis, and renal dysfunction. Additionally, it's used in the management of hypertension. So we have here the contraindication. So it's essential to be aware of contraindications. So furosemide is contraindicated in individuals with hypersensitivity to the drug, anuria, and severe electrolyte imbalances such as hypokalemia, hypotension, thyroid disorders, and also to a pregnant or lactating mother. So, moving on to the dosage and administration, dosage is individualized based on the patient's response and conditions, and it can be administered orally or intravenously, with the latter being preferred in acute situations. But we have here for the edema, associated with initial dose of 20 to 80 milligrams per day, a single dose increased by 20 to 40 milligram every 6 hours to 8 hours, and approximately 600 milligrams per day. And for the hypertension, it has initial dose of 40 milligrams twice a day. And for the congestive heart failure, renal disease, hepatic cirrhosis, it has a initial dose up to 2 to 2.5 grams per day. So now let's dive into a nursing consideration. So we should always check or monitor baseline vital signs including blood pressure, heart rate, and respiratory rate. Assess fluid status, evaluate renal function through regular assessment of serum creatinine and blood urea nitrogen or BUN. And for the fluid and electrolyte monitoring, monitor electrolyte levels, especially the potassium. Regularly assess serum potassium levels and keep an eye on sodium levels as pyrazimide increases sodium excretion, and watch for signs of dehydrations including dry mucous membranes, decreased skin turgor, and concentrated urine. And for the INO or input and output monitoring, we should always check or monitor urine output to assess diuretic efficacy and prevent overdiuresis. And we should always record accurate intake and output, including oral and intravenous fluids. And for the patient education, we should educate the patient on the importance of taking furosemide as prescribed, emphasizing regular dosing, instruct the patient about potential side effects such as dizziness and changes in urination patterns. And we should advise the patients to rise slowly from sitting or lying positions to minimize orthostatic hypotensions. And for the medication and administration, we should administer furosemide as prescribed, either orally or intravenously. And for the laboratory monitoring, regularly monitor laboratory values including electrolytes, renal function, and complete blood count or CBC, and adjust the dosage based on laboratory results and the patient's response to the therapy. So that's all. Thank you for watching.